know diabetes is linked to a shorter lifespan when not taken care of, and linked to things like heart disease, stroke, kidney disease, and blindness. So the sooner you get it controlled, the better your chances are for not having these complications. So you just found out you're diabetic, and now you're wondering, now what do I do? Today, we're going to tell you exactly how to get started. So when you're diagnosed with diabetes, you may be feeling overwhelmed or uncertain about what this means for your future. And that's valid because we know diabetes is linked to a shorter lifespan when not taken care of, and linked to things like heart disease, stroke, kidney disease, and blindness. So the sooner you get it controlled, the better your chances are for not having these complications. So today we're going to dive deep into what it means to be diagnosed with diabetes and the initial steps you can take to manage your condition effectively with different lifestyle adjustments and the right medical care. See, diabetes is a condition that affects how your body processes blood sugar, and managing it effectively requires a clear understanding and a proactive approach. From learning about your medication options to adjusting your diet and exercise routine, each step you take is absolutely critical. So I think the biggest mistake is that people rely on their once every 3 month visit to get all the knowledge they need. But the reality is that visit is meant for you to adjust maybe medications or look at your glucose log. It's not meant for all the education. And honestly, if it is, then it's really not going to work because it's just not enough time. So you really need to dive deep the minute you're diagnosed. And the sooner you get the knowledge, the better you're going to be, because it can be quite a progressive disease. And the sooner you understand how the sugar is affecting you, the sooner you can absolutely nip this in the bud. This is way easier earlier in the disease. So don't panic. You can do a lot of good work really, really quickly. So here we're going to cover the basics of the blood sugar management and the latest in diabetes technology, and really how you can use these tools to get started. One thing I've noticed is that my patients who control their diabetes extremely well are actually healthier than my non-diabetic patients in so many ways. And I think it's because they absolutely are focused on their health. So big picture, type 2 diabetes is a chronic condition that affects the way your body metabolizes sugar, which is your body's main source for fuel. See, in type 2 diabetes, we have two issues at play. One, our cells become resistant to insulin that we make. And two, the pancreas eventually is not able to keep up with the production of insulin over time. So insulin is this hormone produced by the pancreas that allows your cells to take glucose in from your bloodstream, which is used for energy. But in insulin resistance, the cells just don't respond like they normally do. And I actually do a big masterclass on this topic, but all you really need to understand right now in the beginning that you just found out you're diabetic is that you are currently making insulin, but it's not working as it should. And over time, if it's not taken care of, you will be needing insulin. So it's very important that you take care of this right away. And if I'm honest, I almost didn't go into this because I didn't want to overwhelm you. But I also think a lot of times we think if we feel fine, it's fine. But the reality is it's not. If the sugar is not controlled, it is absolutely affecting your body. So I do want to encourage you basically to take control because you absolutely can. And actually, by telling you that this may lead to insulin down the line, it'll motivate you. Because if I'm honest, my clients and patients do the best. One of their biggest motivators, they tell me, is like, I don't want insulin. I'll take whatever pill or diet, but they do not want insulin. And they're right, okay? I mean, insulin can make this worse and can lead to things like weight gain. So, and low sugars, high sugars, it can be a little more difficult to manage. So if you can fix this before it gets there, you're way ahead of the game. Initially, the pancreas will compensate by making more insulin to respond to the cells not listening to the insulin, but eventually it can tire out, and this can lead to decreased insulin production. So as these levels rise further, the need for insulin injection may happen. So our goal when we're initially treating diabetes is to make us not need as much insulin so we become sensitive again. And in addition, so that we prevent things like weight gain from insulin and can also focus on just doing a healthier lifestyle. So these lifestyle interventions include a healthier diet, increased physical activity, losing excess weight if that was something that recently happened, and all of the above, because they can actually help your body's response to insulin. And there's a ton of other factors, and I definitely go into that in one of our master classes, but that's the big picture, okay? And these are the big things to tackle when you're just diagnosed. Now, they may say you need medications, okay? And these medications are either doing one of three things. They're either helping increase insulin production, improving the insulin's effectiveness, or reducing the amount of glucose that's released by the liver. So, big picture. Managing your diabetes requires a comprehensive approach, which involves diet, exercise, regular monitoring of blood glucose, and adherence to prescribed medications. And these regular checkups with your healthcare provider are crucial to adjust these plans and monitor for complications, especially if your goal happens to be getting off medications. You want to follow as regularly as possible to keep inching toward that. The first step you should do is you want to schedule all your diabetes care team. So what do I mean by a diabetes care team, right? You never hear, oh, my diabetic care team. It's really usually a combination of your primary care provider, a specialist like an endocrinologist, and a dietitian and or diabetes educator. And these appointments can take months to get in. So the biggest thing you want to do is do your research on your own, and in particular, make those appointments immediately. Don't wait until you've been trying things out on your own to make that appointment. It's actually one of the reasons I started our type 2 diabetes transformation method, is because we don't want people to have to wait till their appointment to get access to this information. The other reason was because it takes hours to get all this knowledge in. And rather than picking all these different sources and trying to get everything together, I thought having somewhere where everything's comprehensively in one place would really be helpful for people to just really jumpstart the process, especially when they're very motivated. Because it's very easy to get confused when someone's telling you all this information in a visit and you're expected to just absorb all of it. So sometimes in our method, we have things recorded. It's helpful because you can listen to it over and over again and really make sense of things very, very quickly as to what is actually happening. Okay, so back to it. So when you go to your initial visits, you're going to undergo initial blood tests to evaluate your blood glucose levels. They may relook at your A1C, your cholesterol, your kidney function, and they may even check something called a C-peptide level, which evaluates how much insulin you actually make to make sure you actually are making insulin and are a true type 2 diabetic. These tests are very helpful for your physician to make your treatment plan. And in the same visit, you'll likely review the medications that are most appropriate for your type of diabetes, lifestyle, or other health conditions you may have. And so make sure when you go, you're not afraid to ask to understand the purpose of the medication, the dosage, the timing, and the side effects before you leave that appointment, so you don't come home to any surprises. Because once you leave that appointment, you're on your own. So you really want to learn about your medications and their side effects and interactions. Also, one thing I would say is also bring supplements with you. Often I find people come to their appointment and they say, I'm on a supplement, but I can't remember the name. They're really like thinking, what am I on? Don't do that. Don't waste your limited time with your physician. Bring all your meds, all your supplements. The other thing is you're going to want to plan for your follow-up. Don't wait, because when you have to set up a follow-up at home, that's never going to happen. It's always something that gets pushed to the back burner because we're always so busy. In addition to the medications, what you're going to want to ask is how often you should be checking your blood sugar. See, generally, if you're using a traditional glucose monitor that has glucose testing strips and lancets, make sure you also bring this to the appointment to make sure you can use it correctly. A lot of pharmacies, they have diabetes educators there, and they can actually show you how to do this in the pharmacy when you pick up your equipment. But if not, just go to the doctor's office, bring it with you, make sure you do it correctly, and you feel very comfortable with it, because it's something that's going to be a huge tool for you in the beginning. The other thing is, if you already have the supplies, maybe someone in the family already has it, or you got the script through another avenue, maybe if you're diagnosed in the hospital, they'll always discharge you with the equipment. What you want to do before you go to that first doctor's appointment then is check the sugar before meals and 2 hours after you eat. See, the goal of having these glucose levels is to show your doctor so they know exactly where you're lying, because that A1C is really just a 3-month average. It's not showing you day to day what's happening or meal to meal what's happening. And really, by looking at your glucose levels, you really can actually make goals. If your goal is to become a controlled type 2 diabetic, you'll have different glucose goals than, say, someone who wants to reverse this insulin resistance and have normal glucose levels. So big picture, the ADA and CDC have specific guidelines for glucose goals to manage diabetes effectively. So the ADA recommends a fasting glucose level of 80 to 130. And this aligns with the recommendations by the CDC as well. And then postprandially, the glucose that's measured 2 hours after the start of the meal should be less than 180. And then the A1C generally is less than 7 or 6.5 in certain cases. Now, that being said, if you're diagnosed with diabetes and you're diagnosed already controlled, you may have a goal of wanting to go into the pre-diabetic level, which is, 5.7 to 6.4, or even below that. And that's fine, but just make sure you communicate that with your doctor. Once they understand who you are, what your goals are, they'll be much better to tell you what to do, because they're not going to impose their judgment on you or what they think you should be going for. That's up to you to pick. All they can tell you is the guidelines of what it is to be a controlled diabetic and what medications will get you there, and maybe the nutrition or different lifestyle factors that can help get you there. So make sure you go there really open and honest. And I know that can be very hard, right? Because you're meeting someone for the first time, and it's very difficult to get into all these things. So the more research you do, the better you'll be able to make these goals and discuss with your physician to get to where you want to go. These targets are not just random targets. They're actually chosen to minimize the risk of diabetes-related complications while taking a patient and their circumstance into account. So the other thing you're going to want to do is attend sessions with your diabetes educator to learn about the management of diabetes, including how to monitor blood sugar, how to recognize and handle fluctuations, how to administer the medications if necessary. Now, the first thing you want to do, regardless of what's going on, is make immediate changes to your diet and physical activity. This can include reducing sugar or carbohydrate intake, things like regular soda, processed sugars like cakes, things like this, and then increasing your fiber and incorporating regular exercise into your daily routine. One thing that I want to discuss that I think you should also take by the horns is your mental health. See, when you have diabetes, it can be very emotionally challenging, and consider definitely getting support from a counselor or support group to help you cope. So I want to take this moment to kind of go into more of the ADA guidelines and CDC guidelines. And again, when it comes to these guidelines, especially when it comes to nutrition, it may not be enough for you. I'll be honest. Some of the recommendations allow for higher carb intake that may be necessary to reach certain goals, but it's a good starting point. And odds are, if you didn't know you were diabetic, you were eating a lot more carbs than they're recommending because you just didn't know it was a problem. And that's totally not your fault. It's just the way society is. Our carbohydrate-rich diet is just kind of what's advertised to us and what's easily available. So first thing is, try to aim for foods higher in fiber, like legumes and leafy greens, because these slow the absorption of sugar and improve the sugar very quickly and aid in digestion. So focusing on non-starchy vegetables like broccoli, spinach, peppers, they have a low glycemic impact and they have a high nutrient content. And we'll go deeper into the glycemic index in future talks. The other thing is you want to manage your carbohydrate intake and control blood glucose levels. And there's different lists and things available on the CDC and ADA guideline website, but basically you want to choose complex carbohydrates over simple sugars and always prioritize protein, fats, and green leafy vegetables over even other complex carbs in general. So protein like poultry, fish, they really help support muscle maintenance and they don't spike the blood sugar levels. The next thing is if you do have carbohydrates, you really want to use portion control to enable you to not need so much insulin. The other thing is you want to hydrate very adequately, primarily with water to manage your sugar effectively. And I want you to limit sugary beverages. They really just don't fill you up, so there's really no reason for them. And avoid processed foods if you can, because this is also affecting your blood sugar levels. The other thing is healthy fats are actually a really good thing with diabetes. So healthy fats like avocados, nuts, and olive oil, they can really help protect your heart. And they're crucial for diabetic management as diabetic patients have a higher risk for cardiovascular disease. The other thing I always get when I get a new diabetic patient in the office is asking about exercise. And it's a cornerstone in diabetic management. More than it is for weight loss, for diabetes, it really does affect the blood sugar levels. So I want you to aim for at least 150 minutes of moderate intensity activity per week, such as brisk walking, swimming, or cycling. This helps insulin sensitivity, which means your body will use insulin more effectively to lower the blood sugar level. I want you to keep very big track of your diet and exercise, particularly in the beginning, because by doing this, it's going to be much easier for you to really objectively look at your activity level and your diet. And you'll also be able to use this with your healthcare provider so they can help give you even more tips. Remember, the more you bring to your physician and your nutritionist and diabetes educator, the more they can give back. So really be open and keep really good records. So picking back off of that idea of really working closely with your diabetes educator or registered dietitian, you really want to be able to say what your goal is so they understand how to personalize the advice. So example, in my office, I work with patients individually, but in my group coaching practice for type 2 diabetes city transformation method, this group is a group of people who really want to pair their blood sugar as much as possible and really want to get off medications. And so for a lot of them, the simple guidelines from the ADA aren't going to cut it. And by knowing that, I'm able to really understand them in that capacity. So the idea is that if I can understand what your goal is, it's easier for your physician or a registered dietitian to give you nutrition advice. So example, a bodybuilder isn't going to eat the same diet as me, right? Because their goal is to bodybuild. And my goal is, well, not, right? A professional athlete's going to eat different than, we would. So the idea is when you're diabetic, depending on your diabetic goal, you're also going to eat differently than other diabetics. So your goals are probably the most important thing you can bring to the office, along with your glucose log and what you've been eating and how you've been moving. Because honestly, they don't allow extra time for them to probe you with these kind of questions to really understand what you want out of this. The next thing I want to discuss is technological aids in monitoring. See, often we use the traditional glucose monitor, which includes lancets, strips, alcohol swabs. So lancets are the little pokey thing, little like sword. I think Sir Lancelot with a sword. Anyways, that's what you use. You're going to poke your finger with to get the blood, to put on the strip and put in the glucometer. But a lot of us are actually allowed to have continuous glucose monitors. And these monitors are awesome. Get your hands on one. I'm telling you, it changes the game when you have a continuous glucose monitor because it gives you continuous feedback on what the glucose is. See, the way I talk about a continuous glucose monitor, I think of it almost like a bank statement. If you have a credit card and you wait till the end of the month to check your credit card, the bill is usually horrendous. That's me every October for Halloween with the kids and Christmas. It's absurd. I don't look, and I don't know, I probably ought to look. So to everyone who's savvy with money, good for you. October and December, I'm not so much, but I digress. Back to the topic. So basically, you want to really look at your balance. So when you have a continuous glucose monitor, you're forced to see the sugars all day. So you'll be able to tell, say, hey, breakfast was maybe not good for me, because you can tell because pre-lunch, you'll see the sugar spiked. And then I'm not talking about the spike right after. I'm talking right before that next meal, you'll see what the sugar is. That means at least 2 hours after the previous meal. If you're okay before the previous meal, but then the next meal, right before you're going to eat, you see it's still high, then you can tell yourself, okay, maybe something I ate didn't jive. So you really want to look at that balance and really be clear of what's going on, because it's going to really help you choose something healthier. So say you check your sugar and it's 300. You'd have to be a masochist to go eat a big bowl of pasta after you see the sugar is very high, right? That might be a little harsh, but it's true. When you see it's high, you're likely going to go for something like very clean, like chicken and broccoli. But if you didn't look, you'd have no idea, because you don't necessarily feel when the sugar is high. And if you're not feeling it and you're not looking at it, you're just going to eat like normal. And that is the biggest mistake I see people make. The big brands that are out there are Dexcom and Freestyle, and they're both fantastic, fantastic things. So the next thing I want you to focus on is really focusing on your mindset, because this is totally emotionally challenging. And so I really want you to acknowledge your feelings about the diagnosis. It's normal to feel all the range of emotions, from denial, which is a big one, that it's only because I was drinking some sodas, or anger and sadness. And by processing these emotions first, it's going to really help you take positive action. I also want you to manage your stress. See, when you have bad stress, that increases cortisol, and that's never going to help your sugar. I want you to focus on deep breathing exercises, meditation, and yoga. They all can be quite effective. And I always tell people, don't underestimate the power of a walk, especially after you eat. That will help your insulin sensitivity anyway, but it also lowers stress. Go for a walk in silence and really just be with your thoughts. Or maybe listen to a podcast about diabetes. And that way you really can get yourself ahead. It's the best thing you can do, especially when you're feeling stressed. And the other thing is obviously consider professional help, especially when it's difficult to cope. A counselor or therapist specializing in chronic conditions can offer strategies to manage stress, anxiety, and depression associated with diabetes. The other thing is you have to understand these lifestyle changes are a gradual process. It involves not just your diet and exercise habits, but also the mindset gearing toward proactive health management. So set realistic small goals and celebrate the small victories on the way. The goal can be simple, like today or this week, I'm going to walk 4 days a week for 2 30-minute sessions. That's simple. And I'm going to do this many steps the week after, and this many steps the week after that, to increase your goals slightly. You can do the same thing with things like water intake, increasing 8 ounces every week, so that you really can build up to the habits you're ultimately going to need to maintain this new lifestyle. You also may benefit from coaching. See, there's coaching and there's therapy, and the difference between the two, in my opinion, is that therapy looks backward, but coaching really looks forward often, where you look forward into your goals. And getting a health coach might be the best thing for you, because once you have all the knowledge of what you have to do, and you have your medication regimen, and you know exactly with your doctor how you're going to wean or change things, you may want a coach to help you implement those goals. And in addition, you may want to also see a therapist at the same time, looking back, especially if you suffered from something like an eating disorder, because this is very pivotal to go back and fix what was done in your mindset when it comes to health before you move forward and make a bunch of goals. So remember, having a positive attitude is really going to influence your physical health and your ability to manage the diabetes effectively. The other thing I want you to understand is that an essential part is education. Understanding your condition empowers you to make decisions. And there's so many resources on the ADA website, and there's also things like meal planning there, tips on exercise, medication management strategies, and we'll definitely link that below in the video. So there are good starting points, but you often need to focus outside of this to reach your own personal goals. So don't be afraid to say, you know what, I want more. The other thing is community support. There's so many people suffering from diabetes, and it's only getting bigger and bigger. So there's more people than you can even imagine who are suffering from the same things. There's online forums on Facebook. We have our own type 2 diabetes and obesity support group. So if you type in type 2 diabetes and obesity support group in Facebook, you'll be able to look up our group, and we'll definitely let you in. And other people are all talking about the same thing. So you'll see a lot of the same issues going on for everyone. The other thing is Joining workshops and seminars is also very helpful because these events really dive deep into stuff that we don't necessarily have time to in the doctor's office. So my masterclass on insulin resistance is one I always host, and that really helps people understand big picture what's really going on at a cellular level. The next thing I want to discuss is once you've really gotten your understanding of what you need to do with your nutritionist and your diabetes educator, I want you to start meal planning. Because if you don't plan your meal, you're going to go back to the old habits. You really need to proactively try and change. And this is something that's a little difficult for people because people feel almost like a lack of freedom when they have to plan. But the reality is if you spent that time planning, you'd have so much freedom in your day not thinking about what you're going to eat. And that's really rewarding. So the other thing is I really want you to monitor the sugar very carefully while you're eating and following your meal plan because you'll see whatever you plan if it worked or not. Now, I also want to transition when it comes to planning, if you are taking medications, to make sure you take them correctly. So go over that with your doctor and also try not to forget them. I know it's so easy to forget them. You get up in the morning and you're rushing to get out of the house. And if you've never taken medication before, it's very easy to forget. I always tell people this. You're supposed to brush your teeth twice a day, but I feel like remembering in the morning is a guarantee. So maybe put your medication next to your toothbrush. Brush your teeth in the morning, chug a big glass of water, and then have your medication. If you need to take it with a meal, that's fine. Keep it by the meal, but make sure it's somewhere where you're always going to be in the morning so you don't forget. The other thing is staying hydrated is definitely key for regulating blood sugar levels. So aiming for at least 8 glasses a day, unless otherwise told by your doctor, is a good strategy to get started. So before we wrap up today, let's recap the key points we discussed. We highlighted the importance of understanding diabetes and making necessary lifestyle adjustments, utilizing technology to really check your sugar levels in a comprehensive way, and by having significant emotional and community engagement. And don't forget to proactively work with your team being your primary care doctor, hopefully your endocrinologist, diabetes educator, and nutritionist. And don't forget, once you've made that plan with them, I want you to really focus on getting that done and focusing on your goals and getting into everything one small action task at a time. It's not big acts that fix your health. It's those everyday little habits that you gain that make you do it. So I encourage you to stay proactive about your health, continue educating yourself. You have completely got this. Okay, well, that's it for this one. I'll see you guys in the next.